Good afternoon, everybody, and again, I also share my condolences with the family of the latest person to unfortunately pass away at Northwood. We now have 58 Nova Scotians who have died due to COVID-19. Again, a reminder of the potential serious nature of this disease. Today, I'm reporting we have 2 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,048. Both of these new cases are related to Northwood, one a resident and one a staff member. So we continue to have no cases now for the last few days that are related to or that are outside of Northwood, which is continuing good news. The QE2 lab processed 427 tests yesterday. We currently have 8 people in hospital, 4 of those in intensive care. 961 people can be considered recovered. We now have had 37,405 Nova Scotians who have tested positive and had negative results. We remain with two licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. One is Northwood with 16 residents and 4 staff, and the other facility has a single resident who is still considered an active case. So as you can see, overall, our epidemiology is headed in the right direction. The number of new cases continues to remain low, and the vast majority of those are related to the Northwood outbreak. And so that's very pleasing to see. I've been talking a lot with a lot of different groups or in consultations in the last couple of weeks, and I can keep using the phrase new normal, and I think that's a phrase we're going to all have to get used to. As we would come out of the first wave of COVID-19, it's not about going back to where we were in 2019. This is about a new normal living with COVID. That as we come out of the first wave, and we're talking more and more about how we recover. It is about the new normal, which things need to maintain. Some things need to be maintained that allow us to live with COVID in a reasonable and balanced way. We have done reasonably well through the first wave. It has certainly had substantive impacts, but I think overall we've been able to limit the impact directly from COVID, and we can all be proud of our ongoing collective efforts. But again, this isn't over. We are likely to see, even as we're coming out of the first wave, we have to understand that we are likely to see a second wave sometime later on this year in the fall or winter. Nobody can be definitive about that. The reasonable experts would say we're likely to see a second wave, but not exactly sure when and not exactly sure how severe it would be. So, but even between now and any possible second wave, as we continue to work now to reopen our society in a way that finds the necessary and appropriate balance by continuing to have an important level of control over COVID-19, while at the same time reopening our economy, reopening our society, but also in a way that finding that balance is what creates our new normal. There are some things that are going to have to remain in place for a long period of time that allows us to find that appropriate balance. That those are the tools we have to continue to control COVID. Many of them are ultimately about what we do as individuals and what we do or don't do. And then the recovery is all about building environments, whether it's a business environment, retail environment, any sort of community environment that has an appropriate level of safety, that by supporting many of those individual behaviors, such as good hand washing, making sure we can physical distance when at all possible, limiting non-essential travel, certainly people staying home whenever we can when we're unwell, and building support so that people can do that, limiting large groups of people getting together, especially indoors, and in finding certainly people wearing non-medical masks in certain situations, especially when there are people are getting together and they can't respect social distancing. That's certainly something at this point we would like Nova Scotians to certainly consider that. While we want all our COVID numbers to stay low, it's also vitally important as we move into this recovery time that we continue to be vigilant, have a strong surveillance, and that we need to make every reasonable effort that we can to identify every single case of COVID-19. To that end, today we're announcing that we're expanding the list of symptoms that we're using to screen people for COVID-19 testing. This is based on national conversations. We've learned over the last few months that the COVID-19 actually can present in a more diverse way, a greater number of symptoms than we originally understood at the beginning of the first wave. All other provinces are adopting the same broader list of symptoms for the same purpose of making sure we have a very low threshold for identifying, testing somebody who may have COVID-19. So beginning today, if you have any one of the following symptoms, we're asking people to contact 811 to go through the online assessment, if possible. If not, calling 811, and then you'll get further direction. So anybody with any one of having a fever, or having chills or sweats, a new or worsening cough, sore throat, headache, shortness of breath, muscle aches, sneezing, congestion or runny nose, hoarse voice, having diarrhea, unusually tired, unusual fatigue, a loss of sense of smell or taste, and red, purple, or bluish areas on the feet, toes, or fingers that aren't there without a clear explanation. I know that's a long list. That this information is all on our coronavirus website as well. But any of those symptoms, we want people to call and do a further assessment. I have to emphasize, though, that all of these many of these are very common symptoms, and just because you have one of those, I don't want to create undue stress. In all likelihood, if you have these symptoms, it's not because of COVID, but it's very important that we test you to rule out COVID. It remains critically important. Our recovery, it needs to be informed by very good active surveillance. It's far better that we test large numbers of people, having lots of people be negative, better being safe than sorry. But it's also important that if we do have a positive test, that was somebody that we otherwise didn't recognize. And that's very important for us to know that. So again, there's a large number of symptoms. Many of them are common. It's important that if you have them, get tested, but I don't want people to get all stressed and anxious just because we're asking them for a COVID test. It's just an important part of our active surveillance and having a very low threshold for testing people to rule out COVID. And again, you can access the usual ways remain. We've worked with 811 and our assessment centers. They're well aware of this. They're prepared for any increased volume of calls to 811, any increased volume of testing. I was hearing earlier today that we're already seeing more calls, and that's exactly what we were expecting and what we want. More people calling with common symptoms, making sure we test them when appropriate, as really important part of our active surveillance at this point in our recovery stage. I also want to touch on one other topic, which is keep getting lots of questions on, which is the use of gloves in a non-medical setting. It's important to understand that a very strong recommendation across the country from public health that we do not encourage the use of gloves. It's important that we see a lot of people, and what gloves do is give people a false sense of security, and they're much less likely to wash their hands. The virus gets on gloves just like it gets onto your hands, but because you're wearing gloves, people are much less likely to actually do the appropriate and thorough washing. So it's important that people rely on good, frequent hand washing as the way to keep their hands clean, not on wearing gloves. And especially if you think that you're going to be out and about touching a bunch of surfaces, picking up objects as you're out in public, and that you want to protect yourself by wearing gloves, I would say don't wear gloves. Make sure that you can wash your hands frequently as you're doing that, and certainly before you go back to your car or before you go back home, making sure you have some hand sanitizer, washing your hands carefully. But please, we are strongly discouraging the use of gloves. I hope with the loosening of restrictions over the last couple of steps we've made that people are starting to feel some normalcy returning to their lives. It's important that people continue to reconnect with your community, get outdoors and be active, but to do doing it safely. It's quite warm and muggy out there today, and I know I'm hearing lots of reports where people are headed to parks, trails, and beaches with a weekend ahead of us, and we really are all need to have some warmer weather ahead of us. But please ask people. It's important that you remember that no matter where you are, that it's important to continue to practice the physical distancing. If you do need, it's important if you drive to a park or a trailhead or a beach that even though there are maybe other cars parked there, keep social distancing when you're in the parking lot, as you're walking to the beach or getting onto the trail, going into the park. Groups if you're in the same household or a bubble household can be together, but make sure you're separated at least 6 feet from other household or bubble household groups. And again, continuing to practice all the other measures of good frequent hand washing, avoiding non-essential travel, staying as much as you can, doing those activities within your community. If you are feeling unwell in any way, we ask you to stay home. And if any of the symptoms if you're not sure, just go and do the 811 online assessment tool, and considering wearing non-medical masks, especially when you're out and about in public and you can't be assured of keeping that physical distance. So I wish everybody a safe weekend. Get outdoors and get some fresh air, but continue to do things safely. Continue to look after each other. Practice everything we need to do with care and compassion and building a positive sense of community. Have a good weekend.